Good evening, everyone. I'm Mo Harrington. I'm the Assistant Director of Development here at ACR Health, and I would like to welcome you to the last night of recordings and presentations for the Hike for Life, where we are doing 23 days of presentations on wellness to celebrate 23 years of serving our community in 9 counties and beyond. Tonight, I am really excited and honored actually to be joined by our harm reduction team tonight. We're going to be talking about harm reduction. We're going to be talking about all of our prevention services. And this is a very challenging topic tonight for a lot of people. And I know that when we started specifically doing things like syringe exchange, it was also very controversial. So for anybody that is uncomfortable talking about this, or for anyone gets triggered by anything that we're talking about, please know that you can reach out to anyone on our staff at ACR Health, and the numbers and all of our information for contact will be available immediately following this production. So first of all, I want to welcome all of our players tonight. We have Megan Weston Flanders, who is our SEP Prevention Health Advocate, SEP is Syringe Exchange Program. Ryan Sorrell, who is our Syringe Exchange Coordinator. We have Ben Prespiora, who is our Substance Service Program Coordinator. So if you have ever had Narcan training or been in need of Narcan, Ben would pretty much be the guy that you're talking to. Ethan Lewis, who is our Harm Reduction Supervisor, and we're very, very honored to have our Director of Harm Reduction Services with us tonight, Roberto Gonzalez. So welcome, everyone. I, first of all, want to pretend like I know nothing at all about harm reduction services, that I don't work for ACR Health. And when I'm looking up the definition of harm reduction, which I think is fascinating, what I'm getting is harm reduction is a strategy that aims to reduce the harms associated with certain behaviors. When applied to substance abuse, harm reduction accepts that a continued level of drug use may be inevitable and defines objectives as reducing adverse consequences. It emphasizes the measure of health, social, and economic outcomes as opposed to the measurement of drug consumption. Wow, that's a lot. And what I really want to know is, what does harm reduction mean in terms of our clients, in terms of serving the people that we take care of at ACR Health? And I'm going to hand that question right over to our director, Roberto.
Thank you, Mo. Thank everyone for tuning in tonight. This is a fascinating time that we're in, especially our last day of the Wellness Summit. So harm reduction is a combination of policies, procedures, and programs, as Mo defined. But it really stems for ACR Health, for our programs. It stems in our approach. It stems in the way we are able to identify and connect with people who use drugs. We're able to build that trust with them, build that relationship with them, and engage them into services and get them either services within the agency or any other services that they may need throughout the agency. When we talk about harm reduction, we focus on reducing the harm that people cause themselves associated with their behaviors, whether that's reusing syringes and causing themselves to get abscesses or miss shots, whether that's putting themselves at risk of overdosing. We teach them different pieces of education that prevents them from overdosing and that prevents them from contracting HIV or hepatitis C. I'm gonna let my team talk a little bit about the work that they do, because they're on the front lines, and how they incorporate harm reduction in their style and with their experiences. And I will pass it off to Ben.
Thanks, Roberto. I appreciate it, and thank you for letting me speak here tonight. So a little bit of my background in my experience, in this field, really, this is really important, and kind of how I got to where I am in this is, years ago, I took a job in Oasis Early Intervention, which meant that I was going to substance rehabilitation facilities and providing HIV testing for those who are in the programs. Okay, now this could have been an inpatient, it could have been an outpatient facility, but this was like my first real time, working with people who use substances in these settings. Um, you know, and it's funny when I think back about it, how these experiences really kind of form my principles today and my strategies today. Um, when I used to kind of walk the halls at the inpatient, you know, I don't know that too many people, they didn't know who I was. I didn't have the brand on of the facility we were in. And so they're like, who's this dude coming in to run our group? And so, if you've ever interacted with me, I don't know that I'm always the most talkative in the world, but I'm just kind of sitting up there kind of quiet. And so I would eventually go into leading our group educations and our discussions with the people who are participating. And it was through those that I think that people really learned, what we were about. And that was kind of promoting ACR Health Services, whether it was syringe exchange, whether it was our volunteer group, whether it was any of our other support services or a medical clinic. It was talking about all of those. Now, if we are in, this was like 4 years ago. So we're talking about OASIS facilities where, maybe harm reduction approaches weren't necessarily, celebrated. But we just gave the education and we just gave what we do, and that was it. And they were more than okay with that. So I'm very thankful for them to allow us to lead those. So when we talked about reducing people's risk of HIV infection and transmission through syringe exchange and hepatitis C infection and transmission through our exchange programs, through using one syringe every time, I would get some mixed responses, but it was in those one-on-one testing encounters that I had where you could really connect with people. And then people are like, hey man, like, this, I wouldn't say this happened a lot, but it did happen. There's people that are like, hey, I wasn't so sure about getting tested with you before, but now that I've talked to you and kind of you've walked me through some things, he goes, this wasn't so bad. He goes, I would do this again. And, I don't think anything of it. So it was pretty humbling for me to hear that from people, especially in those settings. So, there's definitely, when you see somebody for the first time, you don't have the clear picture. So there's a lot of people who might think I was, could be intimidating or not easy to talk to. But then I think once people actually sat down with me and kind of got into the process, they found that I was actually more of a listener anyway. And that was really connecting. And then, being transparent with people and giving them strategies that might help them and, say, hey, look, the experiences that I've seen, if I had been there at one time and there was an individual who was there, okay, if they were in the facility for 2 weeks, 4 weeks, whatever it might have been, and then maybe they might have been in that same position 6 months down the road, there was always that time of, they may feel shame and they would say, oh, hey, oh, you're still here to me. And I said, well, yeah. And, I said, it's good to see you. And they said, well, is it? And so my response would be, well, hey, yeah, man, you're here. It's good to actually see you, that you're in front of me today. And we talk about it and say, it's not those things that got you here today. It's the fact that I'm standing here talking to you that's important to me. So when you are able to kind of connect with people on a group basis like that, and then, kind of, kind of break that barrier down when you are working with them one-on-one, to say, I'm not here to judge you about what you feel like you may have done or what you may feel like you're ashamed of, but I'm just happy you're here. That was kind of the best part about it. And kind of establishing that trust with people and keeping them engaged in the services. And then so like in terms of engaging them in services, it's just letting them know what we have to offer. And it's, hey, we know that the real world things happen. Okay, things go out there and they don't always go as planned. And we know that. And, nobody's immune to that. that happens everywhere to everybody. So, you know, like if you ever feel like, you know, if you ever feel like you're not going down the path you want to go on, you know, we're here for you. You know, and, you know, giving them a card is one thing, but letting them know that you're there, you're open to listen, and that there's a whole team, you know, of people in this building, you know, in other buildings too, of course, but, you know, since I work here, it's best to speak on the one I know about. Uh, you know, they know that they can come to me, or they can come to Roberto, they can go to Ryan, they can go to Ethan, they can go to Megan, they can go to those people, and they can get, you know, that same non-judgmental care. And how can we take care of you the best today, now that you're in front of us? I think when you take those strategies into consideration, you think about, you know, treating people as people. I think all those things, it's, you know, your approach in talking to people, and, you know, maybe having people sign up for our service. It's also, that's how you establish a trust, and that's how you engage them in those services, and you make people feel comfortable with those things. And that keeps them engaged. And when we do all of those things and we put them all together, that is our goal. Our goal is always to, you know, I mean, it's mine specifically, but I know I have a group of people around me that do the same things in very different ways. I'll be the first to admit that I'm a unique bird, but you know, we have the same goal in mind, and that's making people, you know, live their healthiest lives as we can. Not making them, but empowering them to do that, and letting them know that, like, when things go not the way that they planned in their goal, that there's always a good day to get back on track, for less of a better term. But to live the way you want to live, and to keep them healthy, and to keep them, you know, feeling like they're connected to something. And that's the most important thing to us. And just one last thing before I go, because as I said, I may appear to be quiet, but I'm not, is that I know that, you know, in terms of the community, you know, that we live in, Mo, as you said, I do Narcan trainings. I do them quite a bit. I do them in the community for businesses. I do them for people in outpatient clinics. I do them for people in their homes. And I'll never forget the experiences I've had training people in their homes and talking about some real stuff, that, you know, just giving them an alternative viewpoint, and looking, you know, getting those looks of, I don't understand this. Can you explain it to me a little better? You know, those things are what we're here for, and that's what we're trying to do. And, you know, it's my thing. It's like, I'm not here to tell you how to think. I'm not here to make you feel this type of way. But if I can give you this viewpoint, and you can open up and listen to it and find that it might work for you, it seems to work for us. You know, that's really our goal. And so being in those homes of people who are concerned about a family member, you know, maybe a friend, or whoever, just knowing that there's, you know, there's options, there's always a chance, and, you know, for people to live healthier lives. And that's what we try and do. And we find when we do that consistently, you know, then we can reach our goal, whatever that might be. So I didn't have a timer on me. I don't do well with time anyway, but I think my time might be up. I'm going to pass this over to Megan Weston Flanders, you know, and I will let her take it from here. So thank you, everybody. I appreciate it.
Hi guys, thanks for having me. I found there's a lot of different strategies to use when working with clients. When we're in the office, mostly, offering our services, and I found personally for myself offering self-disclosure. I myself am in recovery. I struggled with substance use for many years, and just letting clients know that I've been there, I've faced the struggles, and that I understand what it's like. And also letting them know, like, even though I'm sober now, it doesn't mean I'm judging them. I don't ever want anyone to feel like I'm pushing anything on them. If they want to continue using substances, let's keep them as safe as possible as long as we can. And often clients come back in and they're like, okay, I'm ready. They know then to come to us when they want help. Office is a little easier because we know why clients are there. They're there for the syringe exchange. But when we're on the street doing street outreach, obviously it's a little different of an approach since we don't know who the active users are and who they aren't. When approaching people on the street, I will usually start out by asking if they want some condoms or juice or something just to start the conversation. Sometimes they just walk by, they don't want really anything to do with my juice or my condoms, but other times they'll stop and talk, and it'll open the door so I can tell them where I'm from and the different services I offer or we offer. I say the syringe exchange, a lot of times people are like, oh, what's that? And they're very interested and they want some of our services. Other times we can link them up with health insurance navigators or whatever they need. And other times they just want my phone number, and sometimes they call, sometimes they don't. I'm not going to go on for 10 minutes. That's basically all I got. Ethan?
Sure. So, you guys both, Ben and Megan, you both spoke on some of the technicalities of harm reduction, Narcan, syringe exchange. I think for me, the most important part of harm reduction is the connection we make with clients, and an authentic connection, right? Being who you truly are, right? Because they know when you're faking it. And that might mean something like having a client coming from the syringe exchange program into the medical clinic and going, can I get a snack? Yeah, man, you can get a snack. Like, it's fine. Get some water, go to the bathroom, do your thing. So that if there comes a time when they're looking for medication assisted treatment, they know that redhead who always gives them the water and always throws them a snack is going to be there and sign them up for an appointment. Or we have clients who come in and go, I can't find the syringe exchange program. And I'm like, it's a great day. Let's go for a walk, and literally harm reduction is sometimes walking them from one building to the other, dropping them off and saying, hey, my friend Tone's going to help you. He's good at this. He's got you, right? And creating these authentic connections with people, because like in the end, I think that's what matters. When people miss their appointments and I call them and I say, hey, we miss you. You missed the last 2 appointments. Can I schedule you for another one? Is that something you're interested in right now? I have the reaction I usually get is, wow, no doctor's ever chased me down like this before, right? And I'm like, listen, I want to make sure you're okay. And you know what? We're human, and sometimes we miss appointments, right? Doesn't mean you get to be punished, we're just going to get you back on the schedule, and we're going to do what we can if that's what you want. Sometimes they go, yeah, you know what? I'm not really ready for that. And I go, hey, like, can we hook you up with a health navigator? Can we get you insurance? Can we, maybe I see you have Hep C. Are you ready to get that treated? You don't have to go to me, right? There's so many other services, or, if you want to go to the SEP, that's awesome. I encourage that. I think there's a belief for some folks with the medical clinic that like, oh, if I'm going to the syringe exchange program, like we can't let the medical clinic know. Like, heck no, we're going to walk you over there, because if you're still using, maybe a lot of times it might be, you know what, I'm really ready to kick heroin, but I still kind of want to use cocaine. Okay, well, let's get you over there. Let's get you some syringes and let's figure this out. Okay. So like, that's my approach to harm reduction, is seeing everyone who walks in as a person who is valuable, a person who is loved, a person who means something to someone, and treating them like that, and treating them with the dignity and respect that every single one of our clients deserves, and connecting. Because I think without the connection, none of these services matter. And that's kind of my stance. Ryan, do you want to take it from here?
Yes, and hello everyone. Thanks for joining us. Harm reduction, something like Roberto mentioned, we're frontline workers, and I find that implementing harm reduction can be just little things, and trust is a big thing. If you get the clients to trust you and Megan mentioned disclosure, which is one way I build that trust that leads to getting them to implement some of the harm reduction, um, some of the harm reduction methods that we promote, and letting them know that I have lived that lifestyle and I've implemented these harm reduction techniques, and they're not that hard to implement. They are really, really easy sometimes, little things like, you come to the syringe exchange, you get enough syringes and you have clean syringes there. So use a new one every time, and just not just using a clean syringe, but clean everything and being completely sterile. And then, the way you inject into your body also affects it. Shooting in the right places to minimize scarring, and and you tell them these things and tell them I've implemented these and you can do it too, and I've been there. It's not just some knowledge that I learned in a book and I'm expecting you to do something that's unreasonable or really not practical to implement into your life. And I find people are a lot more receptive sometimes to people that have lived the lifestyle that they are currently living. And I work very closely with Megan, a daily basis, and the rapport that we've built with our clients is, I see her with the clients and how comfortable they are. And there's certain clients that, we've heard from friends of theirs that they look forward to it, that, Mondays and Thursdays are their favorite days of the week because the syringe exchange is open. I can go down and chat with Megan, and, she's going to give me some knowledge, maybe just let them know, like, things that may be potentially dangerous out there. We hear about trends and people will talk to us because they trust us. And they can tell us, hey, I've heard there's some, pills going around that are made with fentanyl, or I heard there's some Molly around that's been causing people to overdose. And, they can share that information with us, and we can in turn around and share it with them, with other clients. And it's, it's a lifestyle that as providers, we live too, just like, those people have their lifestyle. And it goes so much beyond, just the simple, drug use and a new syringe. And
Brian, can I ask a question? So, both you and Megan spend time out in the outreach van, and it just is it's such powerful work, right? I mean, the connection that you're making with people to even get some people not through a day, but just through an hour, right? Just, looking forward to that time and making a connection with the two of you simply because you understand what they're going through or how they're feeling. Can you just tell me, like, what's a good day that you've had at outreach? Like, what's a good memory or a good day, the definition of a good day that you can share with us?
wow, well, it's funny. I remember the first client I enrolled on my first outreach 6 years ago. And, I still see him in there to this day. And, and to know he's implemented a lot of those harm reduction techniques. And it's, or to have, I've had clients come back because we distributed Narcan and tell us that, thank God I got this from you yesterday, because my girlfriend's sister mother used it on me yesterday because I overdosed. So it's just to know you literally saved a life. Like, those days are priceless, to know that you did that, and you were there when somebody needed something that bad. Or even, you know, have people just just because we talked to them, or have, you know, literally they came in there for syringes and left with a whole new outlook on life, and their life will turn around. I'm so sorry.
No, please, you know what? This is life. This is real. This is the real life, my friend. This is great. Yeah, it's great. Megan, do you have a story you want to share about, you know, being on outreach? And
we haven't gone out that much because of COVID, but Tuesday, just the other day, it was a really productive outreach. We did enroll one new person, and this actually is my first time being a syringe exchange staff going out on outreach, now that I think of it. And so I'm not used to doing the exchanges. Previously, I worked in substance. And I think we enrolled one client, and we served, I think, 6 or 7, or did transactions, gave them new syringes when we went out, and it was just a really productive day. And we stayed right in Utica. Yeah, like I said, it was just very productive. We weren't open that day, and if we weren't there, they probably would have been using old syringes or sharing them. You never know. We also gave out a couple Narcan kits, and it was just nice.
what do you say to people that tell you that it's not happening in my neighborhood? It's not happening here in my hamlet where I live.
Oh, I know where we were earlier. They actually think that it is. I mean, I don't really know how to convince them otherwise. A lot of areas just want to ignore it like it's not happening, but unfortunately it's happening everywhere, and ignoring it is only making it worse. And it's not, I mean, there's IV drug users everywhere, and the homeless population, like I can't get over how many people slide through the cracks, and there's just not services in these areas because they don't think there's a problem, or they don't want to face it. So I don't know. It's very frustrating though.
Thank you. Thank you for sharing that. Roberto, I want to know how important that whole idea of no judgment, just help is. That mission statement, that line that, you know, ACR Health uses. How important is that?
It's extremely important. No judgment, no stigma, is what, you know, is at the forefront of our message, is at the forefront of our initial encounter with everyone we encounter. I mean, our initial approach with everyone we encounter. You know, that's what separates ACR Health from every other service provider around in communities, is the fact that clients, people, individuals, human beings know that they can walk into any one of our facilities and not be stigmatized for who they are, not be judged for the lifestyles that they live. They know that if they see us in the communities, if they see us on outreach, and they are familiar with us, they can approach us and not feel like they have to be different, or they have to be something that, you know, they have to put on a face for us. Like Ethan said, they can be their authentic self with us, just like we are with them. Thinking about outreach, I remember in the early years of me being on the front line in the syringe exchange program, because of our approach, because of our continuous eliminating the stigma and breaking down barriers and being non-judgmental towards people, we had 2 clients who came to visit us to access services. And During the encounter, they provided us with information on a house, a location where there have been multiple overdoses. The people were, it's a 4-story house. People were using just about on every floor. People who were homeless were just stopping in, injecting, cooking up drugs, doing whatever they could do. And it was, to them, it was a safe place, but at the same time, it was a very dangerous place because people were overdosing. People were literally dying or almost dying in this house. So they provided us with that information, and we set out. The entire syringe exchange team, we set out. We went to this house. As soon as we knocked on the door, the people that were already in there already knew who we were, and they invited us in. Come in, please, come in. We needed you guys. We've been waiting for you guys. They were more excited than what we were about finding out about this house. They were more excited that we showed up. Yes, we had a big RV outside, a little showcase, but they were more excited that we showed up. They invited us inside. The reports that we received were completely accurate. There were people all over the place. There were syringes all over the place. We cleaned up the entire house. We removed as many syringes as we were able to remove. We provided Narcan trainings, overdose aftercare counseling, and Narcan kits to just about everyone in the house. We enrolled new people into the program, and we made referrals out of that encounter for people who needed shelter, for people who needed other services. And I never forget that. And I believe Ryan was with us at that time, and he was brand new as a peer. And, it was, initially it was like, oh no, this is really happening. This exists. But it felt so great to know that they trusted us. They trusted us because we don't stigmatize them. We don't cast any judgment on them. And they trusted us to tell us, hey, we've been over here, we've been hanging out there, but they really need your services. That was like the very first time, and that outreach always sticks with me because it really wasn't an outreach. We were in the office and we weren't supposed to be on outreach that day, but it just happened where we received the information and we all looked at each other like, let's call the peers and let's all go out. Like, we really need to attend to this.
I think that that's one of the things about ACR Health too, is that we meet that need. We meet people where they're at. It's not
Right.
about the fact that you're on outreach or you're not in your office. I mean, I think that so many of us are reachable whenever the need is there, especially in our harm reduction program. And I think that that's so important for people to understand. So thank you for that. I also wanted to just mention really quickly about, you're talking about picking up syringes. So I want to let people know that I will be putting a link up at the end of this video as well with Antonio, who does a very fine job at explaining exactly how to dispose of a syringe if you come across one. Because it's not something that you should be doing if you don't know exactly how to do that. So just so that everyone knows and everyone is safe.
Thank you.
I'm sorry. So I would love you to continue if anyone else wants to share another story. And I also want to ask Ethan, because of course, they have an amazing definition of what harm reduction is and how it affects everybody, because we do it every day. We all do harm reduction every day.
So yeah, I was talking to Mo a little bit, who was, like, how do I frame this harm reduction question? I'm like, the thing is, we all do harm reduction every single day. I have a vehicle out there, right? It's kind of a death machine if you really think about it, right? Cars are dangerous, okay? But no one sits there and tells me never drive. What they tell me, go the speed limit, wear a seatbelt, don't use substances before you get in the car. You got to have a license, right? Those are examples of everyday harm reduction, right? It doesn't eliminate the existence of car accidents, right? But it makes it so they happen less frequently. And when they do happen, they're not as deadly, right? And so, once we start looking at things like that, I think harm reduction can become a relatable topic, right? It's not just about use of drugs, right? We engage in harm reduction every single day for most of our lives, right? You can't eliminate the danger, but we try to reduce the harm. And I just think that's an interesting way to think about it, to be honest with you. I don't know what anyone else thinks about that, but when I talk to people who are not in this field about harm reduction, they think, oh, well, like, yeah, you're right. I kind of do engage in dangerous behavior every day, but nobody stigmatizes me for it, right? They just try to make it as safe as possible. So
I do think that that is an everyday kind of a thing, right? We all engage in harm reduction. And I also think that, every one of us are looking for relationships, going back to what Ryan was talking about, where we just can trust, where we can trust our story with someone else and in the right hands, where someone isn't going to judge us. And I know that that is an important piece of what we do at ACR Health, is that we try to help people and eliminate the barriers. Can we talk a little bit about the barriers? What would be some of the barriers that would stop people from coming into, let's say, our clinic, or walking up to, Megan and Ryan talk about, walking up to that van and getting those services?
One barriers, people are afraid that law enforcement will get their information, or their PO, their probation officer or parole officer, or that they're being enrolled in a syringe exchange program could actually be detrimental to their well-being.
And we know that there are laws in place, right, to protect people. Roberto, can you talk a little bit more about that, perhaps? Because there's even things like if you're with someone who's having an overdose,
Yes.
you
yes.
want to make sure that people know that they can get help without being judged themselves, simply by getting help for the person that they're with.
Yes. So people, there continues to be a hesitancy, and it is a barrier at times where people think their information is not kept confidential. Even we see that when we attempt to collect overdose reports. People are hesitant in providing us with detailed information on the overdoses. No matter how much we try, we do tell them that it's confidential. This stays here in ACR Health. We don't share your information with anyone or any law enforcement agency. We encourage people to really call first responders when an overdose occurs. And we explain to them, even though they may have a Narcan kit on hand, and it may work, there's still a chance that this person may go back into an overdose. So you want a medical professional, EMTs, to be there to assess the person. That's important, and we stress that as much as possible. The barrier in that is that we still find ourselves, receiving reports of law enforcement, of just not so great encounters by law enforcement. People who do call 911 still experience either harassment, detainment, just different, they have different experiences. And we really do try to empower people to know the law and stand up for themselves. If they encounter if they call 911 and they have a negative experience with law enforcement, let law enforcement know that they are aware of the Good Samaritan law. They know the law. and they know that they're protected under the law. If they encounter law enforcement and they have a hypodermic syringe on them, and they're enrolled into the syringe exchange program, we do also stress that that they keep their syringe exchange program card handy on them. That doesn't always happen, but we do empower them to tell law enforcement that they are, they know the law and they are enrolled into the syringe exchange program. 9 out of 10, when people tell law enforcement they're enrolled into the syringe exchange program, they pay it no mind. And they pay it no mind as they don't charge them. They don't pursue this any further. There are several occasions that do occur where whether the participant has a card or not, they still get charged. And at that point, we tell them that they need to come back and report that to us, because then we intervene and we advocate on the client's behalf to get the charge dismissed, which we have done several times. Our biggest thing is just education and making sure that the clients have the education, are aware of the laws, and know that if they find themselves in a situation that they shouldn't be in, to speak up. Speak up. If it still doesn't turn out the way it's supposed to, come back and let us know.
Thank you, Roberto. And I know that you've also worked a lot with local police enforcement. Have you seen changes? Is it improving?
Yes. We've done a lot of education around with law enforcement. In certain regions, we're partnered with law enforcement as far as providing education and trying to prevent further overdoses. Outside of that, the reported cases of people still being charged at overdose scenes, or people still being charged for possessions of syringes, have decreased a lot. We still get reports here and there, and it just really depends on where the incident occurred. If it's more in the rural areas, we hear reports of people still being charged. Depends on if the officer who's responding or made the stop is aware of the public health law. And it's also depends on the actual encounter. If there's other paraphernalia, if there's other drugs involved. Syringe exchange possession laws do not protect people from being charged.
Does ACR Health train specifically? Does it train law enforcement?
No, we have not fully. We have provided some trainings during roll calls for law enforcement in different areas, different police departments.
But do we provide that formally to law enforcement agencies?
We do not.
Okay. All right, that is something that we should definitely be looking into.
We do have state liaisons from the
Yes.
State Department of Health that do provide law enforcement, formal law enforcement trainings on harm reduction, syringe exchange, and overdose prevention. And they've been really great about responding to any incidences that we ourselves were not able to resolve.
Fantastic. I want to keep on this topic of overdoses. During COVID, I think that we've seen an increase clearly because, I want to talk about why. Let's talk about why during COVID, why we've seen an increase in overdoses, and then I want to talk to Ben a little bit about Narcan.
Well, when COVID-19, when the first wave or the outbreak initially occurred, agencies like ours was not prepared for that. We were not prepared as far as having the proper PPE in place. So like everyone else, we had to close our doors, and other programs across the state had to close their doors or minimize their services. When we resumed our services, we've received a lot of reports of a lot of overdoses that occur and a lot of fatalities as well. The reason behind it was because people had no resources. They had nowhere to go. If someone is homeless, someone has is living in poverty, has limited resources, and the only places that they have to access these resources closes down,
Right.
then that leaves them without anything, right? And when and the hysteria, just seeing what's going on around the world in the news, and that definitely played a role into people using more substances, um, some people fell into depression, anxiety, and had to use more substances. So we saw a huge increase in overdoses and overdose fatalities. When ACR Health SET resumed services in the streets, we noticed that people, once they knew that we were there and they started visiting us, they didn't want to leave. They hung around our area just to talk. And so many stories, so many conversations, from the people that we serve, that they were lonely. This is the only place that they come to talk to people, to have that encounter, that connection. And there was a lack of that for a good 30 days in most of our regions.
Thank
And I'll
you.
definitely let Ben touch on that a little more.
Yeah, Ben, I've got a question specifically for you. So you train a Narcan, a life-saving medication that is available, and the training is available. And I do want to say that all of our services at ACR Health are confidential and free, as well as our Narcan training. And Ben, I want to know, so who's coming to you? Who wakes up in the morning and goes, I need a Narcan training? Who should come to you? How about that?
Anybody and everybody. And so, that's a big umbrella answer, but we started to see, to kind of piggyback off of Roberto, when he was saying, when people are feeling in those isolated ways, like it's hard, to get resources out. We had Narcan throughout, the COVID-19 shutdowns, and, our syringe exchange team, when they were able to provide services, we were able to give it to people, and we do quick trainings. I mean, trainings can be as quick as 5 minutes, depending on the amount of time that people need, or, we can do more formal ones that take up to, 60 minutes and beyond. Just depends on the setting, but anybody and everybody. We got calls from individuals who didn't know where to turn to, and they didn't know if we were open. And when they didn't know we were open, it seemed almost like relief, like when we were talking to somebody, I didn't expect anybody to answer. Here's what I need, and do you know where I can get it? And if it was something that, if they couldn't get to us, we would try and locate a place in their area where they could. But, it's always open for people to come down. I mean, and be trained either really quickly. And sometimes people just want to talk about what their experience was like, and why they might need Narcan. So anybody who's ever experienced an overdose, we encourage to inquire about it. Anybody who's ever, responded to an overdose or been around the scene of an overdose, let us know, because if you're in those areas where they happen and you can respond, we want to encourage and empower people to do that. And also it's for, people who may be living with someone who, may be engaging in use. And in that case, we can go over those aftercare strategies too. And we can make sure that they're or trained to respond in that moment and what they should do, even beyond. So anybody and everybody. And if they're not able to get to us, we'll try and locate a place that can.
Thank you, Ben. I know that I have taken the 5-minute training, and I know that I have taken the hour and 15-minute training, and both of them have been wildly successful. I've actually used my Narcan kit twice myself, and I can tell you that it is both empowering and scary. So I thank you. Thank you. Okay, so whew, that was a moment. You know, I had a moment using a Narcan kit. I think it was probably the second or third month that we were closed down during COVID, and no one was in the building. I think it was myself and Derek and one of the other volunteers, and we had all had Narcan kits. Someone called an Edna Blue code over the line, and I was on a Zoom call with Carrie, and someone said to me, "You have to go because there's no one there." Because I'm not on that committee, you know, I'm not on that call normally because I'm never in the office really. So I went out, and it was one of the most scary, life-affirming moments I think I've ever had. And so Ben, I don't know if I've ever thanked you, but thank you. I really appreciated that, because without that Narcan training, I would have not known what to do, and his life was saved. And it took many, many shots of Narcan to get him out of that, but it was a definite life-altering moment for me as well. So thank you. So I have a question for everyone, and I want you to take, you know, your time in answering this, and I would like to hear from everyone on the panel, because I know that the work we do is controversial. I remember I've been with the agency for 10 years, and I remember when we started our syringe exchange program, just as I began, and it was very controversial, and people just didn't understand it. But what I want to know is the work that we're doing, is it working? Is the harm reduction method working for the people that we serve and the communities that we work in?
I would say that it absolutely is. You know, success has all different forms in how you look at it, but it absolutely is. We know that, you know, people come to us every day, you know, for whatever it might be. And you know, whether you see, you know, people who keep coming back, or whether you see new faces every day, you know, you can just see it. And in those interactions, you can affirm and come to the conclusion that what we're doing, we're connecting, we're reaching, and we're providing that care. Absolutely.
You want to throw it to somebody, Ben?
Take it away, E.
I knew that was coming. So I guess, first of all, the idea, does medication assisted treatment work? Yeah. Like study after study after study shows it's, you know, folks who are taking Suboxone, folks who are taking, we don't provide methadone, but other places in the community do. These substances, they reduce relapse, right? And every time we can sort of help someone who doesn't want to use anymore not to use, that's a good thing, right? That reduces those overdoses. That's going to reduce those long-term effects of use, right? Which aren't just, you know, issues with syringes, but also, you know, liver issues and just life issues that come along with using. So when people want to stop using or want to reduce their use, yeah, MAT works. I also think the approach to the clinic works. You know, you talked a little bit about barriers. And one of the biggest barriers we face, I kind of call it every doctor who came before us. People who use substances are treated poorly in medical settings. They're treated poorly when they go to the ER. They're treated poorly when they go to the doctor. So that's a huge barrier we're fighting, right? Is that you know, when they walk into our nurse practitioners, we might be the 5th doctor and they've been treated poorly by the first 4. So they come in with some trepidation, right? And some fear. And I think showing them that we care about them authentically, right? And like Roberto mentioned, the stigma, we don't do that here. Like that's not how we treat people, and that's not how we're treating our patients, can help the healing process when it comes to not just seeking medical treatment for their substance use, but maybe getting that Hep C looked at, maybe going to that doctor's appointment they've been putting off. All of those things that they've been putting off just because of the way they've been treated by every other doctor before them. So I think not only do we help with their substance, but we help with their overall health and well-being by showing them that really there are alternatives out there and there are good doctors, and let's try to set you up with one, right? So that we can stop this cycle of stigma and avoiding doctors, because we have people, and I know the SEP has stories about people who have serious medical conditions who have been avoiding doctors because they know exactly how they're going to be treated once they get into the ER. So for me, not only is it working for their substance use, but it's working for their overall health and well-being. I'm going to pass it off to Ryan.
Yeah, I absolutely believe that the work we do works. I mean, I believe that the HIV, as the rates, the infection rates among injection drug users has been reduced by, I'm not even sure of the exact numbers, but I want to say in the 90s, almost half of injection drug users were HIV positive, and now it's like under 2%, maybe 1 or less at this point. I know the stat was last year, maybe it was the last time I checked, and it was probably a year old at that point. So I know it's absolutely working in reducing HIV infection among injection drug users and hepatitis among injection drug users. And it's like, again, Ethan said, and back to Roberto, the work we're doing, the most important work we do is reducing stigma, because the best way to reduce harm is to reduce stigma. And, you know, the best, and with the Narcan trainings, you know, that Ben does, and normalizing, you know, these things helps bring it into the mainstream, and people will accept it. And now the Surgeon General, I believe was last year, released a public health advisory advising everybody to carry Narcan. And if everybody understood these people and the problems and everybody carried it, you know, it would reduce death from overdose, you know, a lot. And then, like I said, the work we're doing every day is reducing HIV and hepatitis C. And I see it with my own eyes. I see people getting treatment for hepatitis every day. And that's something else that comes to the clinic, is hepatitis treatment. So yeah, I absolutely, I don't believe it's working. I know it's working. I know the work we do saves lives. Absolutely.
Thank you, Ryan. Megan?
Is she back?
Roberto?
I echo everything the team members spoke on and said. I've been here a little over 6 years, somewhere around the 6-year mark, maybe a little bit over. Who's counting? But you know, I started our second syringe exchange program in the Mohawk Valley. I saw this program start from no clients to almost 1,000 clients where we're at today. So many lives we touched, so many people we've impacted, so many families we've helped. and we still lost a lot of people. This wall behind me is a wall just out of the Mohawk Valley of names that we keep there and we look at every day to remember. These are the people who need our services, who needed our services. These are the people who we're here for. And we're here for a lot of other people every day trying to prevent their names from being on that wall. We know this works. We're out here, we're on the front lines. We live and breathe this. Harm reduction is just 2 words. We meet people where they're at, and that's real life. Thank you.
Well, we are at the end of our hour, but I do have so I want to thank you all for joining me tonight. This has been a remarkable end to a remarkable journey for me to reintroduce myself to what this agency does and to be able to reintroduce our programming to the community and the important ways in which they can also be a part of it too. They can be a part of breaking down the stigma. You know, we did have a question from someone and you know, what would you say to the community? What would you need from the community to break down this stigma? Because people, we hear the word stigma all the time, right? What exactly does that mean? How can they help to reduce the stigma?
I'll start, Ben. First and foremost, they're human beings. We're all human beings, you know. We all have family members, friends, people that we know, and even if we don't know them, who use drugs, even if we don't know them, they're still human beings. They're still people. Whether they're successful, whether they're not, who are we to impose any judgment or stigma on anyone else? We're no different. When we look at each other, we breathe the same air. We live on the same planet. We should treat each other with the same respect. If somebody is down and out and we see that saying hello might brighten their day, then let's say hello. Let's open those doors for them so they can get any type of help that they may need. If we think somebody's going through something and we have our opinions about their lifestyle or whatever's going on, let's still treat them with the decency and respect that they deserve, and just provide some advice, some simple conversations. This is what I would do instead of stigma, judgment, and that's ugly. And you know, we really should be, everyone should be trying to remove that and eliminate it. I'll let Ben take it from there.
Yeah, you know, in saying that to anybody, you know, who's willing to listen, you know, treat people as people. I mean, you never know what's going to happen, and you never know what somebody else next to you is going through. And like, I think about it this way, a little encouragement for anybody goes a long way. And like, if anybody has ever, if anyone's ever been, you know, where life moves pretty fast one day, and you're walking somewhere and maybe someone holds the door open for you, or somebody, you know, allows you to take, you know, the last bag of chips on the shelf or the last drink or whatever it might be, you know, that's a very, very small thing, in a world that sees a lot of large moments. But it's something that could turn anybody's day around. Or you hear those pay it forward things all the time, people paying for the person in the drive-through, the meals behind them, and just doing, you know, little small things that are unexpected that can really turn somebody's day around. You know, and those moments can last a while. And so, you know, we are all people. It's the same thing. It's not cliche because it's true. And that's really what I would try and tell people, is always keep an open mind, because You never know what the person next to you is going through. And you never know what little encouragement might push them past what they might need. And so I'll pass to Ryan.
Yeah, so I am actually sometimes a little surprised by the amount of stigma that still exists, because at this point, I mean, when you go to work, when you go shopping, look around. That guy over there, he's an addict. That lady over there, she's dependent on opiates. They are people, you know, and like, kind of go back to what Roberto said. Find the person. Everybody's got a family member, a cousin, a friend, um, who struggled with it. Sit down and talk to them, and get to see that they're a person, they're human, they're, you know, and just that simple fact of recognizing their humanity can change, you know, your outlook on this problem, and what it'll take to actually move forward in, you know, the fight and ending the stigma and the discrimination that these people face. Ethan?
I think, and I mean, I'm also surprised by the amount of stigma out there, especially when, you know, sometimes it's about drugs of choice, right? Like, you want to look at the Dunkin' Donut line at 7 a.m. and tell me that people don't have a caffeine addiction, right? Like, if we made that illegal, I think life would be very different for people in the Dunkin' Donut line, right? And so sometimes what I think of, because I think there are times when we're all a little tired and we all get a little judgy, and that's just about being human and recognizing it. I think, who the heck am I? Am I a person who's never made a mistake? Am I a person who never chose something I probably shouldn't have, or done something I probably shouldn't have? Like, I think to myself, I could have ended up on a million different roads. And that road might have been the person sitting across from me, right? Like, I might have ended up on that road, because we're both humans, and that's life. And remembering the person across from me struggles, they have joys, they have loves, they have things they get excited about every day, just like I do. And just remembering like that humanity that everybody has discussed here, and just holding on to that and going, okay, this is just a person just like me. I think that's the most important thing.
Thank you so much. This has been a remarkable hour for me. And Megan, Ryan, Roberto, Ethan, Ben, it is an honor to work with you all and share some space with you. So I appreciate your time and your honesty and sharing your stories, your journey, you know, from day to day, from minute to minute, hour to hour. I really appreciate it. And I even love the baby crying. On the dogs barking. Roberto, I have one more question for you. And that is, so you run this program, and you've got all these amazing people working for you. And, you know, there's a need. There's a need in this community. There's a need in many communities. There's a need individually, program-wise, for our agency. What do you need from the people that hold the purse strings? What do you need from what do you need? What do you need from our lawmakers? What do you need from our police? What do you need from the people that hold the power? Talk to us.
We need support. We need support. We need recognition. We need collaborations. We need you to let us in, let us at the table. We want to sit at the table. We need you to hear us, because this is more than just about people who work on the front line. This is a lot of people's lives, a lot of people's lives. We serve a lot of people. Over 5,000 people are one half of our program serves. We need support. We need on the law enforcement side, we need you to look at people who use drugs, at our people, like they're people, if you feel like they need any services, or if they need to make any changes or anything like that, not arrest them, not lock them up, not charge them, send them our way, send them to ACR Health. We'll take that on. Send it to us, and we'll work with them, we'll connect with them, and we'll meet, whatever needs that they feel like they have. But definitely the support of the community, support of funders, support of the state lawmakers, law enforcement, harm reduction, again, 2 words, but the work is real, and we're out here on the front line saving lives, and that's also real.
Thank you. I've got 4 more words, and that is no judgment, just help. Thank you so much, everyone. Have a lovely evening, and I appreciate your time tonight. Roberto, if you could just give me one more close-up of that beautiful wall that you have behind you.
Yes.
Good night, everyone.
Good night.